Welcome to Webinar Wednesday, everyone. Today we have Dr. Pamela Smith discussing common female disorders. Please type any of your questions into the Q&A box and she will get to them as she goes. And thank you all for attending. You will also receive a follow-up recording of this in an email tomorrow as well. And thank you so much, Dr. Smith. The floor is now yours.
Well, thank you. Hello, everybody. Today we're going to be discussing common female disorders. So a little variety today. A lot of this is based on my new book, What You Must Know About Women's Hormones, what just came out a month ago. It is available in bookstores and on Amazon, and it happens to be #1 on Amazon this week. So we're very excited that people are actually going to be learning more about hormones. So today we're going to begin with fibrocystic breast disease, and we're going to cover several different disease processes. Fibrocystic breast is a benign condition where the patient has lumps in her breast. Lumps may be tender. Less commonly, the patient may have pain severe enough to interfere with daily activities. This condition is called mastalgia. The lumps may occur at around the same time of the menstrual cycle every month, or may not be related to the time of the cycle. Fibrocystic breast disease is common and occurring in about 50% of all women. Cysts are benign conditions that are not associated with an increased risk in breast cancer. So we always want to reassure the patient of that. However, they may be distinguished, and they must be distinguished from cancerous masses. So mammography, ultrasound, MRI, needle aspirations, and biopsies are ways to distinguish it, but usually ultrasound is enough for most patients. Studies have shown a strong association between fibrocystic breast disease and the intake of caffeine. So the first thing you would do on Monday morning is to have the patient try and stop caffeine, or at least certainly cut down. When the patient goes to the third cup of coffee, or she goes to the third cup of iced tea or tea, she does leach 45 milligrams of calcium from her body. So moderation is the key to health. Caffeine and medications that contain caffeine all inhibit the action of cyclic AMP and cyclic guanosine monophosphate phosphodiesterase and elevate their levels in the tissues of the breast. That's part of how this disease process occurs. High levels of these nucleotides stimulate protein kinase activity, which increases the production of fibrous tissue and cystic fluid. Some studies do not show an association between caffeine intake and fibrocystic breast disease, just to be fair, but after 44 years of practice, I will absolutely tell you, cutting down on caffeine helps the patient. Stress has been shown to also play a role in fibrocystic breast disease, since fibrocystic breast respond more to epinephrine, which increases cyclic AMP production. A study found a correlation between fat intake and the risk of severity of fibrocystic breast disease. The association was positive for all forms of fat, but particularly for saturated fats. So like most disease processes, we want to look at what do we do on Monday morning by beginning with how the patient eats. Iodine deficiency may further be a contributing factor. I'd like to measure iodine by first morning urine. I really do believe it is more accurate than blood. It's very inexpensive. So I have the patient do a first morning urine, nice and easy, and then we determine, do they have iodine deficiency? I rarely start, probably never really start people on iodine without measuring. Still looking at the etiology, fibrocystic changes in the female breast may be the end result of a series of biochemical events initiated by the mast cell degranulation products histamine and heparin. Two mechanisms are proposed which lead to this breakdown. First, low progesterone levels lead to decreased intracellular cyclic AMP levels in mast cells, which enhance the mast cell degranulation. And as you're going to see, fibrocystic breast disease is commonly a low progesterone state. So when I see the patient, I do order a salivary test. Commonly, the women are still cycling. So if it's a one-day test, they would do it on day 21. If they've never had a saliva test, I'd like to do a 28-day test. So we get 11 specimens throughout the month. Or if they're going to do a one-day test, days 4, 14, and 21, if they've never had a saliva test, to give us more information. Second, low progesterone levels lead to increased solubilization of breast collagen during tissue turnover, and susceptible patients may undergo an allergic reaction to soluble collagen, resulting in further mast cell degranulation. Degranulation products, histamine and heparin, may stimulate increased stromal proliferation and vascularization, respectively. So we do want to treat that mast cell breakdown if that's part of the problem. We're going to talk about that too, but to give you an easy one, I like to use quercetin. Quercetin 500 milligrams twice a day is a great natural way to help with mast cells being overproduced. Estrogen dominance has been associated with an increased risk of developing fibrocystic breast disease. Again, that is going to be on the salivary test. What do we do for the patient? Very, very simple. We can do a liver detox, and we also want to look at gut health. Remember that part of estrogen is broken down in the liver, part is also broken down in the GI tract. A study showed an inverse correlation between the intake of fiber and the rate risk of developing benign disorders of the breast. Conventional therapies are here. Oral contraceptives are usually the most common one. Patients should wear a support bra and, of course, stop smoking. From a precision or anti-aging medicine approach, dietary changes, nutritional therapies, medications, and other therapies are helpful. So a trial revealed that limiting the intake of coffee, tea, cola, chocolate, and caffeinated medications in the diet resulted in an improvement in these women. There's other dietary considerations as well that help. So helping if the patient has a low fiber diet, increasing soluble fiber is helpful. A study showed that supplementation with good soy protein has revealed a reduction in breast tenderness and fibrocystic breast disease. The study found a decrease in the variability of tissue activity over 1 year of soy use. Study that was uncontrolled, patients that ate a low-fat diet had less mastalgia and improvement in their fibrocystic changes. So people should not eat really a low-fat diet, but a good way to say it is a good fat diet. Nutritional therapies, iodine, evening primrose oil, vitamin E, vitamin A, and thiamine. Iodine. Studies have shown that women with fibrocystic breast disease obtain substantial relief from the oral administration of iodine. There's your dosages, usually 150 micrograms is recommended by the FDA for adults. The daily recommended limit is 1 milligram. So some studies suggest 3 to 6 milligrams. Honestly, I've never had to do that. 150 micrograms is fine for most people with fibrocystic breast disease. Again, measuring is important. Patients have an increased risk of developing thyroiditis or thyroid cancer if they get too much iodine, and that is the reason for measuring. Other possible side effects of iodine are listed here. The most common one is acne. I do see that quite frequently, particularly if the patient comes to me on iodine and no one has ever measured it. But the patient can get any of these side effects. Evening primrose oil has been shown to be effective for fibrocystic breast disease and mastalgia, 2,000 to 3,000 milligrams a day. Vitamin E, alpha tocopherol, has been shown to relieve symptoms of fibrocystic breast in double-blind studies. In uncontrolled studies, vitamin E was effective in many of the women studied with fibrocystic changes, and studies used between 200 international units and 600 in the mixed tocopherol form. At 400 international units, vitamin E does become a blood thinner. So if the patient is on a prescription blood thinner, then probably not the place to go. I do see some questions in the chat box and Q&A. I will address those after we go through each of the disease processes. Vitamin A, there's retinoid receptors in the breast tissue, which can affect breast changes. A small clinical trial of only 12 women, they were given large doses of vitamin A that you can see here for 3 months. More than half the women who finished the study had significant improvement. Some patients had to drop out due to side effects. This is not my favorite one, but it is reported in the medical literature. If the patient has had being a smoker, if they're a smoker, then they should not have more vitamin A than 8,000 international units ever, because it increases their risk of getting cancer of the lung. Thiamine. In a case report, a woman who was deficient in thiamine due to alcohol intake had fibrocystic breast disease. She was given thiamine and she had dramatic improvement. Medications. In human trials, thyroid hormone replacement resulted in clinical improvement. So when we look at things in anti-aging medicine, we look at optimal function of the thyroid. So in other words, if the TSH is 4, that is not optimal function. We also want free T3 and free T4 to be dead center of normal or slightly above. We want reverse T3 to be normal, and of course, thyroid antibodies to be negative. So when we look at thyroid replacement, if the TSH is 4, then measure iodine levels. If iodine is normal, then go ahead and start thyroid hormone. In this study of over 200 women, they had improvement with desiccated thyroid hormone. But again, we only started if the patient is depleted. In other trials, women with fibrocystic changes that were euthyroid, according to standard laboratory studies, were given thyroid replacement. They found a beneficial effect. Progesterone. Fibrocystic breast disease is commonly an estrogen-dominant state, where progesterone levels are low in relationship to estrogen. So again, measure saliva. Other therapies for fibrocystic breast disease, liver function. Since estrogen sensitivity is related to fibrocystic breast disease, it's important that estrogen be metabolized in the body. Lipotrophic factors such as choline and B vitamins are needed to break down estrogen. Do not use estrogen metabolization testing, or do use estrogen metabolization testing to make sure the patient is breaking down estrogen. Do not supplement with choline if the patient does have a high TMAO. So measure TMAO first before you would give choline. Measurement of methylation pathways may also be helpful. And of course, a formal liver detox is usually where I go with this instead of choline and lipotrophic factors. I just do a 1 to 3 week liver detox. Colon function. The study revealed that women who had fewer than 3 bowel movements per week had a risk of fibrocystic breast disease that was 4 times greater than women who had less than 1 bowel movement a day. Again, you can do a test of GI function where you can look at estrogen breakdown and to see if it is metabolized correctly. And I commonly do that test. Microorganisms in the GI tract can make estrogens as well. They metabolize them with the result in the absorption of estrogens made from the bacteria, along with reabsorption of estrogens that were previously conjugated. So now we'll go ahead and open it up to questions. So try and put your questions, if you can, in the Q&A box instead of the chat, because I will always go to Q&A first. Which labs do I use for iodine testing? There's a number of great labs. I personally use ZRT, Access Medical, and Doctors Data also do great tests as well. I have used all of those people in my practice, and they all are very accurate. Thought on tocotrienols. Tocotrienols do work for this. It's just not usually the first place I start. TMAO stands for trimethylethylamine. And if TMAO is elevated, the patient does have an increased risk in heart disease. Some of that elevation is hereditary. Some of it does come from the gut. So if you fix the gut, the TMAO may go down. If it doesn't, then it's hereditary, which is about 1% of the population. You can do that study. It's a blood study. It can be found at any major laboratory, Quest, LabCorp, any major hospital. It is a fasting study. And if it's high, the patient should not eat eggs. They should not eat red meat. They should not supplement with choline, and they should not supplement with L-carnitine either. So people are going to be on choline. I now measure TMAO. In what ways does birth control contribute to fibrocystic? Actually, it really will improve it because it brings the other hormones down, because when you're giving the oral contraceptives, yes, progesterone goes down, but the oral contraceptives contain estrogen, so the body actually makes less of its own estrogen. It's kind of paradoxical, but that is what they use for this. As you all know, I'm not a big fan of oral contraceptives. Oral estrogen is usually not the place to go. If you're talking about birth control, certainly there's other methods that are very beneficial. So liver detox protocol, there's a number of great companies, Metagenics, Orthomolecular, Designs for Health, Biotics are some of them. There's other great companies as well. They all make a really good liver detox, depending on whether you want to do a 1 week or a 3 week. For example, Core Restore by Orthomolecular would be a 1 week, but all those companies and more make really good liver detox. What to recommend is, I honestly, to have the uterus removed, we're on a different subject now. So that would be something we would handle at another time, or maybe today if we talk about another disease process here. And I think we have all the questions. Next is decreased sexual interest. Causes of decreased sexual interest in women: low testosterone, low estrogen, low progesterone, low DHEA, high or low cortisol, and hypothyroidism. The number one cause is stress. People always think that it is low testosterone. It's not. So the first thing is women, all comers worldwide, only 1/4 of women that are not on oral contraceptives ever lose testosterone. Now, if a woman's on oral contraceptives, then sex hormone binding globulin goes up, so the amount of available testosterone for the body to use goes down. But for everybody else, honestly, no one needs to really just say, hey, here's testosterone to take. You always need to measure by saliva testing. Only 1/4 of people will ever in their lifetime have low testosterone. So for example, I will be 68 in a few days. I have normal testosterone. If I haven't lost it by 68, I never will. So 1/2 of women reach menopause with testosterone being normal and staying normal. Of the remaining 1/2 will have low, 1/2 will actually have high. So you need to deal with that. So in other words, only 1/4 of women have low testosterone. So these other reasons come into play. So treatments: fix the hormonal imbalance, of course. Do a saliva test, and if any of these hormones are abnormal, then go back and balance them. Stress reduction techniques: prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques, adaptogenic herbs, and we're going to look at other things. Viafem. This I actually learned from Michael Collins, who is one of the compounding pharmacists that I am blessed to work with now for 30 years. He owns Healthway Pharmacy, and your compounding pharmacist should be your best friend. I learn a lot from my compounders, and this is the one that we use. Apply 1 ml of Viafem to the clitoris 1 hour prior to intercourse. It works as a vasodilator. There's many variations on the theme. We lovingly call this screen cream for the obvious reason. So here's another screen cream. Local testosterone can be applied to the clitoris, but if you do it a lot, you will get clitoral enlargement. So it's my least favorite of these. So that's sexual interest. So we'll stop again after each disease. And if you check testosterone in serum, what are your normals for? I don't check testosterone in serum, so honestly, I can't answer that. I always check my hormones by saliva. I start with saliva because I'm always going to use saliva later. So I don't start with serum because then I would be comparing apples to apples or apples to oranges instead of apples to apples. So I always start with saliva. And when it comes to cortisol, the gold standard, 6 clinical trials, you do have to do cortisol by salivary testing. So I always start with saliva anyway. When we look at the idea of hormones, if the hormones are applied to the skin, they do not show up in the serum. So you cannot use serum for women for estrogen. You can't use it for testosterone since they're applied to the skin. So another great reason why you would do salivary testing. And all the companies that I mentioned do great jobs on salivary testing. It's also less expensive, by the way, than doing blood work. Can you use saffron for low sexual interest? I've seen it in the medical literature. In all honesty, I haven't had good luck with it, but certainly it's in the medical literature. You could try that. How often do I see overstimulation with different vibrators or other devices? You certainly can see overstimulation. So again, that's probably why I don't use testosterone as much. I don't tend to see overstimulation with different vibrators and using the screen creams though. Thoughts on PT141 for an increase in libido? There's some suggestion in the literature that it would be beneficial. I'd love to see more before I would suggest it in a webinar of this nature. Dysmenorrhea. Dysmenorrhea is painful menstruation. The pelvic pain and menstrual cramps may vary in intensity. They may be constant or intermittent, and the pain may radiate to the lower back, vulva, or legs. The pain may start 12 to 24 hours before the cycle begins and last for the first 1 to 3 days of the cycle. Other symptoms that may occur include backache, headache, nausea, vomiting, dizziness, and loose stools. Worldwide, 45% to 95% of teens and women have dysmenorrhea, and 7% to 15% of teens and women have dysmenorrhea that it's so bad that it interferes with daily function. Etiology, there can be primary or secondary. Primary is pain in the absence of organic pathology. Secondary is associated with the pathology such as endometriosis, infection, or ovarian cyst. When you end up with the primary form, there can be a surge in PGF2 alpha, which leads to vasoconstriction and causes the problem. Conventional therapies are prostaglandin synthetase inhibitors, such as nonsteroidal anti-inflammatory medications. Oral contraceptives work by decreasing the production of prostaglandins, and pain medications. What can we do from a precision anti-aging approach? We can look at diets, nutritional therapies, botanicals, and then other therapies. So instruct the patient to eat better. So again, we start with diet. A study showed that participants that ate breakfast every day had less severe dysmenorrhea than those that ate breakfast less often. It's also much better for their blood sugar. Breakfast is the most important meal of the day. Food allergies may contribute to dysmenorrhea by causing a histamine response and an increase in inflammation, which then causes muscle spasm. So I can't figure it out on down the line. I don't start with food allergy testing, but quite frequently I do end up doing it. Aspartame can absolutely make it worse. It's anecdotal information. Aspartame, honestly, is not great for people, but if they're using aspartame and they have dysmenorrhea, then I take them off of it right away. In a randomized medical trial, the consumption of low-fat vegan diet for 2 months helped decrease the duration of dysmenorrhea. So again, have the patient eat a Mediterranean diet. That is the best good fat diet you can find because it's also anti-inflammatory. A study showed that taking the patient off of gluten may be helpful as well. Actually, I've had better success with this than I would thought. It's a 90-day trial. Take them off of gluten and see. Nutritional therapies, we're going to look at all of these. Magnesium, of course, you would think would work because it decreases spasming. It's also been shown to be a cofactor in delta-6 desaturase, which is involved in anti-inflammatory prostaglandins. In one of the trials, magnesium was used with vitamin B6, since B6 enhances the cellular uptake of magnesium. And magnesium was given continuously in some studies and perimenopausally in other studies. So there's your doses of magnesium. For this purpose, magnesium glycinate is commonly used, even to bowel tolerance. It is counterindicated in heart block and severe renal disease, so those patients should not take supplemental magnesium. Omega-3s are anti-inflammatory, so they would be great. I usually start with 2,000 milligrams a day. And studies have shown that omega-3s, very effective. There's the dosages in the medical literature. And again, at 4,000 milligrams and above, omega-3 fatty acids do become a blood thinner. So don't go above 3,000 milligrams a day if the patient is on an actual prescription blood thinner. Thiamine, in a double-blind study, patients were given 100 milligrams a day of thiamine for 3 days. Most of the patients were symptom-free by the end of the trial. The mechanism of action is unknown. Vitamin E, an inhibitor of prostaglandin synthesis, it can increase endorphin levels, which may decrease pain levels. The studies have shown that vitamin E decreases the severity of the dysmenorrhea in these participants, and the dosages that were used in the trials are listed here. Iron supplementation in patients that are iron deficient is very helpful. I was surprised. One patient had dysmenorrhea who came to see me for dysmenorrhea. And she had seen 3 different gynecologists. It didn't work. I couldn't believe it. She was only 24 years of age, and no one had measured her ferritin. It was 4. We ended up giving her IV iron and then putting her on iron twice a day for 6 months, and then iron once a day thereafter. Her dysmenorrhea markedly improved when she got iron. Niacin. In an uncontrolled study, niacin was given to women with dysmenorrhea, beneficial for these patients. Some people can get a niacin flush. If they do, then taking an aspirin about 30 minutes beforehand is helpful. Also, giving vitamin C and rutin will help niacin. This one I don't use as much as the other therapies that I'm talking about today. Calcium. 2 double-blind medical studies have shown that calcium supplementation reduced cyclic uterine pain, 1,000 to 2,000 milligrams. That's actually in divided doses. The body can only absorb 500 milligrams of calcium at a time. Vitamin D. What doesn't vitamin D help? It's kind of like fish oil. Vitamin D was shown to be helpful in both these medical trials, but the doses were high. And the people ended up with vitamin D levels at about 90. We really do suggest 55 to 80 for optimal levels, but vitamin D can be beneficial. Zinc. A double-blind study revealed that zinc supplementation may be an effective therapy for dysmenorrhea. With long-term use of zinc, you do need to use copper, so about 10 to 15 parts of zinc to 1 part copper. Flavonoids. In a trial that was not controlled, the patients were given specific flavonoid preparation called Daflon, and that was helpful. They used it for 3 cycles. It was started 5 days before the onset of the menses and continued until the bleeding stopped. Many of the participants did have improvement. All of these botanicals have been examined and have been helpful. I start with the first one up here, black cohosh, but it's usually mixed together with dong quai and cramp bark and several of the others. Usually I don't give herbal therapies very often by themselves. So black cohosh may interact with some medications, so do be careful with this. The German Commission E does suggest it for dysmenorrhea because it's antispasmolytic and anti-inflammatory. So a very nice smooth of the muscles. So the spasming of smooth muscles and skeletal muscles goes down. Blue cohosh is used as well when there's uterine atony. It promotes uterine contractions and it relieves the spasticity that actually occurs. It's not used as frequently as the other herbs. Chamomile, antispasmodic, anti-inflammatory due to the flavonoids that it contains. It also has sedative qualities. It works very well for dysmenorrhea with diarrhea, bloating, and gas, as well as irritability and anxiety. Chamomile tea is great for this. Dallas is an effective analgesic. It can be used for acute spasms. Cramp bark is really just what its name is. It's taken as a tea. Do use it in caution with patients who take diuretics or are on lithium. And it acts as a uterine antispasmodic and tonic. It's used for pain, dysmenorrhea, and amenorrhea. The mechanism of action is unknown. There's not a lot of clinical trials, but it is commonly used. Dong quai has been used for dysmenorrhea since the 16th century. It relaxes smooth muscles due to its volatile oil-containing fraction. And the aqueous extract contains ferulic acid, which is a muscle relaxant and stimulant. It has an analgesic and anti-inflammatory effect. It also helps with blood vessel relaxing and vasodilatation. Regular use may make the menstrual flow heavier. Just be aware of that. And some herbologists suggest stop taking it during the cycle if the cycles tend to be heavier. Fennel essential oil has an antispasmodic effect and therefore helps with the symptoms of dysmenorrhea. Ginger root is both internally and externally. You can put it on the skin, warm, circulatory, stimulatory effect, anti-inflammatory. The anti-inflammatory effects are due to its effect on the prostaglandin synthesis pathway. Ginger is a thromboxanthine synthetase inhibitor and a prostacyclin agonist, so it has analgesic effects in dysmenorrhea. It also helps with nausea. Some people get nauseated. There's your dosages. And 2 medical trials have shown ginger to be helpful, including one that it was just as effective as nonsteroidals to relieve pain. So ginger is one of my favorites. Jamaican dogwood is a strong uterine antispasmodic and analgesic for the treatment of acute and severe dysmenorrhea. So inform the patient that the recommended dosages should not be exceeded, because I guarantee you, the patients take more, they can get nausea, vomiting, and a headache. Licorice inhibits prostaglandins, and studies have shown the traditional Chinese medicine formula that's listed here works very well. Do not give licorice to people who have hypertension. Motherwort has uterine, spasmolytic, and sedative effects. It also is a uterine tonic. It improves atony due to pelvic floor congestion. It also improves circulation and relieves vascular congestion. Motherwort can reduce pain due to a decrease in endogenous inflammatory mediators and an increase in the synthesis of prostaglandins. It does contain substances which inhibit platelet aggregation. It has hypotensive nervine, so that it does help with headaches, insomnia, and vertigo. It works for pelvic pain with concomitant heart palpitations, anxiety, and stress that may occur with the dysmenorrhea. Motherwort contains all of these things if you're not familiar with it. peony. It's used to treat dysmenorrhea and muscle cramping. It's also commonly used with licorice root for PMS. It's been shown to reduce the size of fibroids. Priscilla is helpful for painful or inflammatory reproductive conditions like dysmenorrhea. It should not be used during pregnancy, and it does have sedative actions that work for nervous tension that may be associated with dysmenorrhea, and it helps with the uterine pain. Yarrow contains lactones, which have an anti-phalagesic activity, and flavonoids, which are spasmolytic activity. And research shows that it is helpful also as an anti-inflammatory. And of course, other therapies, yoga, exercise, massage help with dysmenorrhea. Here are some actual studies showing that it does. So we're going to open it up now again to questions. If a patient vomits severe nausea for 3 days with mild dysmenorrhea, can this be related to low progesterone? It can, but not in all patients. That's an excellent question. So do a saliva test to see, but not in every single patient. And some of the therapies that are herbal that I just discussed work very well for this. What about low progesterone adding in the second half of the month? I only give progesterone if the patient actually has low progesterone. So I am measuring it by salivary testing in each of these disease processes that I'm talking about. Where do we want ferritin to be? Excellent question. Thank you, Michelle, for asking this. So ferritin for men to help the conversion of T4 to T3 has to be 100, and the same thing for menopausal women. So for the conversion of T4 to T3, ferritin 100 for men and menopausal women. It does have to be 130, the ferritin does, for cycling women for the conversion of T4 to T3, since they lose blood every month. For cycling women, again, 130. Conventional therapies, how well do they work for dysmenorrhea? They work for some women, and that's great. I'm just not a big proponent of oral contraceptives for people unless obviously they're looking at contraceptive. So mast cells were found in these patients. Yes, I do use quercetin for the mast cell response. I also use low-dose naltrexone. Some of that mast cell response is inflammatory. So I have started very recently for dysmenorrhea using LDN. I'm starting with 1 milligram a day. Some women I have gone up to the traditional 4.5. If you're not familiar with LDN, then I'll refer you to a previous workshop that I've done that I was the moderator for that we held in December in Vegas. What IV iron do you prefer? Actually, I don't give it. The IV iron is given by oncology in my hospital, so they gave it. So I can't answer that for you. You're concerned about iron supplementation being pro-inflammatory. It's not, as long as the patient actually is missing it. Now, if iron is high, that can be actually a symptom of an inflammatory process. So for example, in COVID, if the patient has COVID or COVID long haul, they may have high ferritin, but that high ferritin is actually a response to what is really an inflammatory reaction that's occurring with cytokine storm. But there's usually not an issue with it becoming inflammatory as long as, of course, you're just replacing it. We don't want the levels high. Chasteberry preparations 2 weeks before menses. I like Zymogen's PMS Soothe. That works very, very well. So other companies have great products as well, but I do use that one in my practice. They describe how you would use ginger. I usually you can use it as a pill or as a tea. And I have the patients take it 3 to 4 days before they cycle and then stop it when cycling commences. 36-year-old patient with dysmenorrhea, onset 12, with clots that are heavy. Bleeding, can no longer take non-steroidals, ferritin's low. First of all, if you replace the ferritin, the dysmenorrhea gets better. What would be the next thing that I would do? I would give omega-3s to this patient. If it's really, really severe, we do use LDN in people who are 12. So you may want to go to that next. B6 for dysmenorrhea, yes, except for I would use B complex. Supplementation with DHEA only in people who are low in DHEA. Can we address menopausal symptoms and the Wiley method? I'm sorry, that's not what today's discussion is about. That's a whole discussion in itself. So I will refer you to Ask the Professor. And if you send in that question, I'm happy to discuss that. Oil iron used. There's a lot of companies that make great oral iron. My personal favorite is Metagenics's Hemogenics. I find that for some people, it's less nauseating. Again, I use many different companies in my practice. I just try and choose the best each company has for their patients. So for my iron, that's Hemogenics. DGL, let's see here. There's a number of companies that make Chasteberry combined. And usually when people have herbal therapies, I just have them take it throughout the month. How do you check the omega index before supplementing? You can actually do a fatty acid test. So if I'm going to use fatty acids long-term, then I may very well do that. The dose of PO iron will depend on which company you're using. If you can't get iron into people, then you can have it compounded and put on the skin. So for compounding, it's usually 50 milligrams that I'm using, and I put it in the base lipoderm, 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 because it's very heavy. It's a heavy molecule, and lipoderm is the base you put things in that are heavy molecule to get into the skin. So you can also put iron on the skin, but to answer your question on PO iron, it will depend on the company. Can we address precocious puberty? Sorry, not enough time to address that today. Please send it in to Ask the Professor. Happy to answer it for you. Most bang for my buck for dysmenorrhea. Certainly the PMS Smooth would be a great combination that you just suggested. After you ran an omega quant, which is one way of measuring the fatty acids, what are your thoughts on algae oils compared to fish oils? If the patient is a vegan, then certainly algae oils would be a selection. Otherwise, if they're a vegetarian or not any of the above, then I do like to use the fish component. There's a lot of great fish oils out there with EPA, DHA. There are some people that need EPA, DHA, DPA. If they need that particular combo, then my personal favorite is Gut Specific Fish Oil by Microbiome. It has all three in it. Not everybody needs all three, but if they need all three, like I do, because I have high triglycerides and dry eyes, then it works very well for that. So again, a lot of different companies to help all of this. And I think we probably got to all of those. Another test, then Omega Quant. There's a number of companies that make good fatty acid testing. So certainly Genova does, Access Medical does, Doctors Data does, would be several of them. And I have used all those companies for fatty acids. So again, for the person who asked on blood levels of DHEA, sorry, don't measure blood for DHEA either. Okay, vulvodynia. Vulvodynia is a chronic vulvular pain that impacts the quality of life issues such as physical disabilities, psychological distress, and sexual function. The pain can be localized and occur in just one area of the vulva or vestibule, or it can be generalized and occur in different areas. The prevalence is 9 to 12% of women. Etiology is unknown. There may be triggers, food and drink that may trigger it. This is out of my book. You are welcome to type out this list and hand it out to your patients. I did. So there's the rest of the etiologies. So there can be chemical issues. There can be dyes that can be a problem, hormones, imbalance, chronic stress. So foods and drink, I like to hand out to the patients if that's the issue. Because some of patients, you can just change how they're eating, and this disease process will greatly improve. Conventionally, yes, lifestyle things are really part of conventional medicine. And so all of these things, and again, I have this printed out and I hand it to my patients. So to avoid potential irritants like soap and douches, don't use fabric softeners, only white toilet paper, avoid hot tubs or pools that contain chlorine, use only cotton tampons or pads, wear loose-fitting underwear that's cotton, do not wear pantyhose, avoid strong spermicides, avoid activities that put pressure on the vulva, like horseback riding or bicycling, if this is a problem, avoid sitting for a long time, avoid intercourse, in other words, after intercourse, if you put an ice pack on the area, then that will help. So not avoid intercourse, but after intercourse, apply the ice pack, and urinate after intercourse and rinse the area with cool water. All are conventional therapies, and all actually are very beneficial. These medications have been used conventionally, along with YAG laser, surgery, etc. From an anti-aging precision medicine approach, again, I do use all of those, but we also are going to look at other things. Physical therapy to strengthen pelvic tissues, exercises to decrease muscle spasms, biofeedback. Hormonal balance is important, so do a salivary test and see where the hormones sit. And if the estrogen is high, deal with that. If progesterone or testosterone are low or DHEA, then replenish it. Acupuncture has been shown to be helpful. Also, compounded estriol vaginal cream. Very, very great. I love this. I start with 1 milligram. The dose is 1 to 2 milligrams. I do specify bases. Mucilax base is a little more expensive. If cost is not a question, then I put it in 50% Versabase and 50% Mucilax. If cost is a question, then I put 40% Mucilax, 60% Versabase. The Mucilax helps with the absorption, whether we're talking about this disease process, vaginal dryness, or whatever. Insert nightly for 2 weeks, Monday and Thursday for 2 weeks, and then PRN. Hypnosis and compounded medications are helpful. So I put some of my favorite compounds here for you. So this would be one of them. Here's another one. So ketamine does work very well for this. So we're going to go ahead and take questions. So if progesterone is low, then yes, we do add that in the second half of the cycle, days 14 through 25. 3 oils I mentioned for dry eyes. Oh, that's omega-3 fatty acids. So there's EPA, DHA, which you're very familiar with, and DPA. Okay. And there's some companies like Metagenics that just make DPA by itself. What lubricants do you recommend if vulvodynia is present? Coconut oil would certainly be high on my list. Do you think kava kava may help with this condition? I haven't found it to be helpful. There is some suggestion in the literature. Honestly, I just haven't seen it, but it's a great question. I've heard trauma and autoimmune conditions can cause a contributing factor. Certainly trauma can. My last case of trauma was not actual sexual abuse. It occurred from an airbag. The patient was, the seatbelt broke, the patient was dislodged, and an airbag hit her in the obvious place. So can trauma do this? Yes. Can it be autoimmune? Perhaps. If you really think there's an autoimmune process related, then I would start with still the same things that we teach you in the fellowship. Number 1, take the patient off of gluten. Number 2, fix the gut. Number 3, start with low-dose naltrexone. Do you have any views and opinions on low-dose lithium and CBD? I do. Actually, low-dose lithium, meaning non-prescription, can work for this. There's different companies that make it, like Designs for Health and Biotics. So you can use low-dose lithium. CBD is probably helpful in about 50% of people. I was very blessed to actually, in December, when I wasn't speaking, to actually sit through the entire CBD THC course on cannabinoids that was in December in Vegas. I found it very enlightening. I really honestly didn't know a lot about the subject. So I encourage you, you can take it online to look at that. CBD can be beneficial. The trouble is they're working on testing now. Right now, it works in about half the people. It doesn't work in the other half yet, but there's supposed to be a test coming out, but yet we don't have one to say which ones it will work in ahead of time. Any help with lichen sclerosis of the vulva? Yes. You can contact me, send it to Ask the Professor, or it's in the book. So I think we answered all of those. Can you use LDN for lichen sclerosis? Yes, you can. And I don't think we're going to have time to actually do all of the rest of these. So, because I actually cut this seminar short to begin with, but I don't think we're going to get through endometriosis in time. So what I'm going to do is do part 2 of this. I'm going to add the part that I cut out of this seminar back in, and we will do part 2 at another time. So I will get that scheduled with A4M. So please watch for that. And right now, I'm going to take the last 6 minutes and open it up to questions in general. Suggestions for clearance of the liver for patients that have high levels of estrogen and progesterone. If they have high estrogen and progesterone, then I usually do a 3-week detox. So again, all the companies that I mentioned do great liver detoxes, but I usually do 3 weeks instead of 1. Also, if people have really high estrogen and progesterone, I do a liver test, a GI test to see where they stand. Now, the company that does the estrogen metabolization in the gut, meaning the stool, that is Microbiome, and that test is called Biome FX. BIOME, Biome FX. Any thoughts on the roles of historical underlying social trauma? I do think that some of these disease processes that we have mentioned today are related to trauma and abuse, incest, etc., and rape. So I do think that this is a big issue. Some of these people do need help with psychological counseling, and it's our job as their health provider to suggest that to them if they have already not sought counseling. There's also a spiritual component to all of that as well. For the patient to be healthy, don't forget the health. They have to be physically healthy, emotionally healthy, and spiritually healthy as well. So I do address all of that with the patient. It's an integrative systems example, especially relevant in COVID area. Again, autoimmune diseases, there are many causes for. Long haul COVID is an autoimmune disease. If you have not taken the workshop that I did for A4M on COVID, it is 3 parts, 2 hours each online. We meet every single month live for a discussion, which is usually quite lively. So consider taking that. It's a very inexpensive workshop as well. Do I use amino acids for supplements for stress? I do, but I usually do an amino acid test. And I see what amino acids they need. And if they need more than 2, I have it compounded. If they just need 1 or the other, my favorite company is Pure Encapsulations if people just need 1 item. Pure Encapsulations kind of specializes in just one thing. If you just need 1 vitamin, 1 nutrient, 1 botanical, Pure Encapsulations is great to go to. If it goes past 2, then I actually have the amino acids compounded. I commonly add vitamin B6 to that process. And adding B6, it works very well because a lot of the amino acids use B6 as a cofactor. I know it's herb to herb, but how much of the herbs would you consider to support them? Do you find yourself using 5 or 10 herbs at a time? Usually it's 3 or 4 herbs that are mixed together by the same companies that I mentioned today. So all those companies usually have 2, 3, or 4 mixed together, rarely more than that. Natural remedies for PCOS. Actually, that was a recent one that I did. So you can find my PCOS lecture in Module 1 of the fellowship, which was taped in December. You can also find it on Disease of the Week. You can also find it in my book. What was the name of the product that had all the omega, EPA, DHA, and EPA? It's got a dumb name, but it's probably easy to remember because the name is hard. It's called Gut Specific Fish Oil, and that is by Microbiome. How do I handle high bilirubin in a 20-year-old? Could this be Gilbert's? It could. I actually have them see gastroenterology to help me make that distinction. The name of my book is right here. It's called What You Must Know About Women's Hormones, second edition. So it is the second edition itself. And that's available at any bookstore or Amazon. Treatment with fibrocystic breast disease, such as supplementation with iodine, mentioned iodine, can cause acne. There are many supplements that can cause acne. Even DHEA can cause acne. Keto DHEA can cause acne. Depends on how acne prone the patient is. And I realize this is not a seminar on acne, but to really answer your question, the best way to treat acne is 2 things. Get the patient off of sugar and fix their gut, because most people with acne have a gut that is not healthy. I'm concerned with the trend in using birth control pills to stop menstrual cycles in women that are young. I have that very same concern you have. Birth control for birth control is one thing, but the studies have shown that when it comes to actual birth control, if the patient takes oral contraceptives for 10 years without a hormonal holiday of 6 months, the incidence of infertility in some studies is 50%. So we always have people, if they're on oral contraceptives long-term, to take a hormonal holiday for 6 months. If you're starting someone at 12 for their treatment of acne by using an oral contraceptive, and they don't need it for contraception, then she wakes up one day and she's 23 and she needs it to prevent a pregnancy that's unwanted. And what happens? She may have trouble conceiving later on. So we try and do all these other things for acne. So what choices do you have considering aromatization changes? Those are all in my PCOS lecture. So white peony, for example, saw palmettos, some of those things. Protocol for painful fibroids. We will come to that. My favorite infertility remedies. We're going to do part 2 of this, everyone. So stay tuned for part 2. Suggestions for best vitamins and minerals for women over 65. Just make sure there's a lot of good vitamin companies. Make sure that if the patient is getting methylated vitamins, you've done a methylation test, looked at homocysteine, looked at estrogen metabolization, or some reason to know they need methylated vitamins. 1/2 of people worldwide need methylated vitamins. The other half do not. I do, my husband doesn't. So I take methylated vitamins because I do have a SNP. My husband does not. And so he doesn't need methylated vitamins. There's 22 different symptoms that I've spoken on before for A4M that you can get if you're overmethylated. And you can also have an increased risk in all cancers. So methylated vitamins for methylated people only who have methylation issues. To test vitamins and minerals, yes, there's a number of companies that make great tests. Certainly SpectraCell, NutriValve by Genova, Vibrant America makes a great test. Access makes a great test. All these companies make really good nutritional tests. And again, I use all of those in my practice. And I promised everybody I would not go over today, but obviously we did not finish. So A4M will be letting you know when part 2 of this seminar will be, so that we will go over some more disease processes. Any final questions? Thank you very much, Melissa. And thank you everyone for attending.
Well, thank you so much, Dr. Smith. It's really been a pleasure as always. We really appreciate all your knowledge. And as a gift to all of you who have attended, we have a special code for $100 off any upcoming A4M course. And I'll include that code in the follow-up email as well. And thank you all again, and especially to you, Dr. Smith.
Bye-bye, everybody. Have a great holiday if you celebrate the 4th of July.
Bye, everyone.